Hi, my name is Navanisha Parmeswaran and my group members are Arvind Singam and Divya Bharati. So here, today we are going to present about the ethical issues in couples and family therapy in Malaysia. Before we going to discuss about the ethical issues in couples and family therapy in Malaysia, let's see what is actually couple and family therapy first. So, couples and family therapy is actually a psychotherapy which helps to reduce conflicts between couples and family. The conflicts can be from marital and couple conflict, parent and child conflict, alcohol and drug abuse, sexual dysfunction, grief, distress among the couples and family. So one of the biggest issue in Malaysia faced by the couple and family is the divorce case. So divorce cases in Malaysia, according to Department of Statistics Malaysia in 2019, divorce case has been increased. So in year of 2017, 50,340 cases were reported and it was increased in 2018 to 50,356 cases. Here, the median age range among the couple and family will be 37 years old for males and 34 years old for females. According to researcher J, who conducted a research in 2019, he found out that financial issue was the biggest conflict among the couple and family, which lead to divorce cases. This is because financial issue is very important. Finance is very important to run a family, to pay bills, to lead a good life. Without money, a family cannot be run properly, and the couples or the husband and wife will be facing stress, depression, less time, and not able to do the household works properly, and lack of physical intimacy, and these are the reason which leads to divorce cases. So what about the domestic violences among the couples and family in Malaysia? According to the International Medical University of Malaysia in 2015, this university have conducted a research and the findings was 39% of Malaysian women have been abused by their partners. Not only that, Royal Malaysian Police PDRM has stated in 2018 that based on the reported cases, there are 5,421 cases has been reported on the domestic violence among the couples and family in Malaysia. Not only that, according to the Star newspaper in 2020, the newspaper article was stated that domestic violence cases spiked during the pandemic COVID-19. Specifically, we can say during the lockdown movement of control in order. So, this issue was the biggest factor to increase the domestic violence among the couples and family because during the lockdown many people has lose their jobs. They don't get a proper financial support, and there is a situation where we all have to sit at home and cannot go out to visit or release stress. So the tantrum, negative emotion, anger have to show to someone, so their partners will be the victim. So this is where domestic violences happen among the couples and family in Malaysia. According to American Association for Marriage and Family Therapy in 2021, they have stated that 90% of couple and family has improvement by going to the therapy session, especially to the couple and family therapy. It is actually effective because all the therapies are based on solution-focused treatment, family-centered approach, and its demonstrated effectiveness. This therapy is only can be done by licensed and qualified professionals like psychologists, counselors, and therapists. Next, how couple and family therapy is going on in Malaysia. Is it accessible for all the citizens in Malaysia? Yes, because are public able to access their services because there are many private and government sectors providing this therapy. For example, in Malaysia, the convenient place for Malaysian are it can be Lembaga Penduduk dan Pembangunan Keluarga Negara, which can be called as LPKNN. It was a government sector which is providing couple and family therapy. So, according to researcher Noor, who conducted a research on couple and family in 2014, the researcher have found that Malaysian community is open to the approach of counseling in handling social problems. Thus, it is possible that couples and family therapists can be primary need for the society in Malaysia. Other than that, this therapy is also highly demandable in this era. This is because this era everyone is busy with their work and everyone want to focus on their work, and they have very less time to spend time with their family. So their stress and depression can be shown to them, and it may cause conflicts among the couple and family. Let's see what are the obstacles does the client face in order to reach out for couple and family therapy. First of all, the client is not willing to open up to their therapist or counselor to talk about the problem. This is because they have lack of confidence to share about their personal issues to another person, which is the therapist or counselor. Other than that, clients are feeling that every session have to pay, so it might cost more money, which is it is expensive. Another thing will be client feel like it is time consuming because they have to attend all the therapy session. Other than that, many of them having lack of awareness on this couple and family therapy.
Gender equality in couple and family therapy. The idea that male is the dominant people in a relationship may be one of the causes of problem in families and couples. Therefore, as a therapist, equal opportunity has to be given to both male and female to voice out their opinion. In a way, a therapist will be able to create an environment that is comfortable to everyone. In addition, the therapist will be able to emphasize the importance of communication regardless of gender by giving equal opportunity to voice out their opinion. They will also be able to emphasize and educate about gender equality from this act. Therapist responsibility in couple and family therapy. As a couple and family therapist, one needs to focus on the family system instead of focusing on only one family member. This is because a family is governed by more than one people, and each family member has the capability to bring changes to the family. Before diving in deep into their problems, it is always essential to look into each family member's role and contribution to the family. Next, a therapist should always be focused during the therapy session. Therapists should be attentive and listen actively to what the family members or couples are saying. This equality may help the therapist to gain more in-depth information as the therapist focus on non-verbal cues and client's intonation. The third responsibility, a therapist should not represent any family members or couple as it may seem unfair to other family members or partner. The therapist should act as middleman and give fair opinion to his or her client.
Apart from that, the therapy itself brings some obstacles to the client. One of the obstacles is lack of competency among therapists. Therapists need the knowledge and skill required to deliver a treatment to the standard needed for it to achieve its expected effect. Thus, when assessing therapist competence, one is assessing the therapist's capacity to provide a treatment to an acceptable standard. As Notch and Beck noted, in the helping profession, people's lives are in the mental health professional's hand. Trainees who do not reach or maintain such standard have professional competency problem. With that being said, according to Faber and Copper, large numbers of therapists worldwide wish to receive training in how to deliver psychological treatment. Administrating treatment without sufficient knowledge, skills, or confidence diminishes the client's trust in the guidance that is being provided. Also, if a counselor seems to be nervous and lacks self confidence, then he or she has some personal work to do before seeing clients. A good counselor also has acquired adequate substantive knowledge and is confident about his or her theoretical approach. Losing sight of one's theory is problematic as it may result in advice that is not scientifically based. Managing clients from different age, stages, capacities, working with multiple agendas and systems, building and maintaining rapport with a range of people all needs extra thoughts with couple and family work. The standard code of ethics needs to be implemented from the AAMFT Ethical Principle of Psychology and Code of Conduct. AAMFT provides the guideline for therapists to solve various problems in their work. Therefore, couple and family therapy should have a deep understanding on the code of ethics related to couples and family. Apart from AAMFT, sources that are useful in solving problems when it comes to couple and family therapy are Ethical Casebook for the Practice of Marriage and Family Counseling, Ethics in Marriage and Family Therapy, Professional Regulation in Marital and Family Therapy, Virtue, Ethics and Legality in Family Practice. On the other hand, competency is defined as the learned ability to adequately perform a task, duty, or role. By being competent, one can deliver quality work or services. Competency are typically acquired in a process of learning by doing in the actual work situation during an internship or in a simulation based learning situation. Competence is an essential factor that needs to be acquired by every employee because people are constantly looking for quality goods and services, and a company can only survive in a competitive market if the company is equipped with competent workers. Therapy's competence is completely different from therapy quality, although a therapist's competence directly affects the therapy's quality. Competency refers to an attribute of the therapist, not the therapy itself. Now we are going to look at the significance of competency. Competency is essential for three main reasons. The first is that all clinicians' duty is to offer the best possible care or treatment to their patients. For those of us who are psychotherapists, This means delivering appropriate psychological treatments in a competent manner. The second reason stems from the pressing need to disseminate evidence based psychological treatment. Simply said, therapists are responsible in giving valid treatments to their client. They have to be competent enough to give treatments that are theoretically proven and effective. The third reason arises from concerns about validity of the research on psychological treatment. To draw firm conclusions from the studies of the efficacy and effectiveness of psychological treatments, it is essential that the treatments were delivered competently. Yet, the true standard of implementation of psychological treatment is rarely assessed.
Ways to maintain competency. According to the competency architecture model Road 2002, there are several ways we can maintain competency. The first one is designing the academic curriculum. Road 2002 stated that curriculum should include all the materials that students need to learn in order to prepare them to successfully enter the field as a beginner practitioner. The second way is to improve initial professional training. Since competency can only be accurate through practice, it is essential for them to learn practice without carrying too many responsibilities for their clients. Therefore, it is important to offer beginners professional work under the supervision of qualified psychologists. The third way is to continue professional training. Psychologists will have to continue learning in order to widen their knowledge and their perspective in the discipline and profession. Case study involving competency. In a therapy conducted by SAW 2015, she consulted a marriage couple, Mira and Peter. The couples had been fighting for years, and after consulting with her several friends, she decided that she needs a couple therapy. Before conducting the session, Saw sent a document containing information about how she conducts a therapy, and she requested Mira to read the document with Peter before their first attendance. During the first attendance, Mira and Peter were fighting for almost 55 minutes. Couple therapy is more complex compared to individual intervention. With that being said, due to its complexity, couple therapy leads us to consider the first ethical question, which is competency. Saw's colleague Kaylee discussed with Saw that she may start seeing couples to build her experience. Saw said that is a great idea, but she emphasized the importance of doing a couple therapy training first. In professional codes, a fundamental requirement is to be competent. So emphasized that is totally normal to do a couple therapy training even we have undertaken over 6 years of training, a generalized master degree in counseling, psychology, social work, or perhaps individual therapy training. She further added by saying that most of the therapists have taken on clients they were not quite occupied to see. However, with the help of supervision and extra reading, they were able to get through. This gives the notion that it is totally fine with the profession that involves continuous learning and it is an acceptable practice and it's worked out well.